Welcome back to Toledo Clinic TV. Our guest is Dr. Maggi Smith. She is a podiatrist, and today we're going to talk about a condition that causes heel pain.
Yes.
It is called what?
It is called plantar fasciitis.
And how common is it?
It is the most common condition that walks into my office. So if you talk to your friends, your family, and you just say heel pain, it'll be unbelievable how many people respond to you. It has been the mainstay of our practice for many years. Plantar fasciitis is a condition that is also known as heel spurs. So you may have some family or friends that come to you and say, oh, I have heel spurs. But really, it's not the heel spur that causes the problem. It is this stupid ligament that attaches to the bottom of the heel that has no function whatsoever that causes the problem. So what is it? What do we do to get rid of it? And what can we do to prevent it? Those are things that I will tell you about today.
Okay.
So what is it? It is nothing more than inflammation at the attachment of the bottom of your heel. So a patient will come in and say, Dr. Smith, I have heel pain. I've had it for a month, and every time I go to get up from a seated position, it hurts. Or in the morning when I first get out of bed, I have heel pain. And again, all it is, if you think about it, is this ligament very similar to what you have on the palm of your hand, but on the foot. So when we're resting, that contracts, and then we get up from that seated position or the sleeping position, and it pulls and tugs on the heel bone. And it's that inflammation that then causes pain. And to the point where some patients will say, I feel like I just broke my heel. And it really isn't. It's just basic inflammation. So what do we do to get rid of it? How do you identify it? What other things could cause it? So it doesn't matter if you are obese, if you're thin, if you're old, if you're young. Anybody can have this condition at any time. I got it when I was a resident doctor, and for me it was because I walked all day long on concrete floors. So it's not uncommon for us to see patients that work in factories that have the condition. If we could just support the arch with something called an orthotic, which is an insert, you can absolutely start with one over the counter. So orthotics is one treatment. Anti-inflammatory medications is another. So if you want to start with something over the counter, such as ibuprofen, naproxen, Aleve, any of those that are over the counter, as long as you're not allergic, would be very helpful for you. Ice is important. So some patients will take a bottle of water, they'll put it in the freezer, and then they'll every couple of 2 or 3 hours or 2 or 3 times a day, they'll roll the bottom of their foot on this frozen bottle of water. You'll stretch the fascia, but you'll also create that anti-inflammation with ice. You can go see your local podiatrist and get a cortisone shot. I had a cortisone shot. They are uncomfortable, but if traditional anti-inflammatories and inserts didn't work, then that would be the next step. They do hurt, but it's totally effective. So 20 years ago, I ended up having a cortisone shot in my heel, and I stretch every single day because I never want another shot. So typically, those are the treatments for plantar fasciitis. Now, what if you're one of those people that in the 5% category that just doesn't get better? We'll then go to physical therapy, formal physical therapy. There are so many websites online that show you how to stretch your foot on a regular basis, how to tape your foot to give it some support. So those things are available to anybody. And if that doesn't work, absolutely go and see a podiatrist. If that doesn't work and you're still having symptoms, we typically diagnose it with a clinical evaluation and x-rays. On some occasions, it could be something other than plantar fasciitis that causes the heel pain. It could be a stress fracture in runners. So your professional would be able to examine you and make a determination of the difference between traditional heel spur syndrome and stress fracture.
Is it something that's more common in runners or not necessarily?
It is not. Anybody at any time, at least every day I probably see it, 10 of the patients would come in with heel spur syndrome or plantar fasciitis. But runners have a harder time getting rid of it. And it's because they don't want to give up running. And that constant pounding on the heel creates a little bit more inflammation. But those patients can do really well with inserts. And if the over-the-counter inserts aren't working, then definitely a custom orthotic would be the next step.
Okay, that's lots of good information.
Yeah,
Thank you so
absolutely.
much.
You're very welcome.
Right. We'll be
Thanks.
right back.